Okay, so you had to get your tooth extracted, whether it was bombed out decay or you had a failed root canal or a drunken bar fight. Either way, you had to get it extracted, and now you have to figure out, am I going to do a bridge or am I going to do an implant? So here's the advantages, disadvantages of each. So a bridge is less appointments, usually 2 appointments. The initial cost is a little less. Not a whole lot, but maybe just a little less. And there's no surgeries involved. Disadvantage is that in order for me to put a bridge on, I have to drill down the adjacent teeth. And when you do that, you're going to compromise those teeth somewhat. All right. Other disadvantage is that now that you have that bridge, you have to clean underneath that fake tooth, and that can be kind of a pain, especially if you don't have good dexterity. It's hard sometimes to get that floss underneath there to keep it clean. A big disadvantage is that if any of the teeth that are holding that bridge on get decay, guess what? The whole bridge has to come off to repair that decay and then replaced. That can be kind of expensive. And if any of those teeth fail that are holding that bridge on, the whole bridge fails. Okay, so that's why the initial cost of a bridge might be less, but the long-term costs may be more. Implants are great because I don't have to drill down the adjacent teeth. They help preserve the bone in the area where the missing tooth has been extracted. They're easier to clean, just like a normal tooth. You can floss it just like a normal tooth. And so that's definitely a big advantage. They look and feel like normal teeth. The disadvantages is that they are more expensive. Not a whole lot more expensive. If we're comparing a single implant compared to a 3-unit bridge, they are just a little bit more expensive, not a whole lot. All right. Another big disadvantage is that they're going to take multiple appointments. So it's not going to be just 2 appointments like a bridge. You may be looking at 4, maybe 6 appointments to do the extraction, place the implant, get the crown done. So it can be longer. And you're certainly going to not have a tooth there for 4 to 6 months. So something to think about. And some implants get a thing called peri-implantitis, where there is a constant inflammation at the gum line where the crown meets the implant. So something to think about. But if it were my tooth, I would choose an implant all day long just because I know it's going to be easier to maintain and probably the costs are going to be less in the long run. So if you enjoyed the video, hit the follow, subscribe button, please. If you have any comments, questions, drop those below. Thanks for watching. That's all I got. Have a great day.